When patients come to Mayo Clinic, one of the great opportunities for them is that we can coordinate their complex multidisciplinary care in a very short period of time. Sometimes patients will come with a diagnosis of multiple sclerosis. Our team will review the patient's story, the patient's neurological examination, the patient's imaging, and we may actually decide that this patient does not have multiple sclerosis. And this is not an uncommon scenario.
MOGAD, or MOG antibody-associated disease, is a new central nervous system demyelinating disease, and our group was involved in developing the diagnostic criteria for MOGAD that was published in 2023 that gave it its own identity. So I think it's extremely important to have the right diagnosis early, because then a patient knows what they have. They have an identity to their disease. It's not multiple sclerosis, it's a different condition, and we know what to expect.
You don't want to be treating a patient with lifelong immunotherapy if you're not sure that the diagnosis is correct. And that's an area that we really can provide some insights.
We are learning something new about MOGAD every day. We're leading the way in much of the research in MOGAD. We're understanding what immune pathways are there, and we're developing treatments to target those immune pathways.
The diagnosis of MOGAD requires the presence of the MOG antibody. Mayo Clinic was the first institution to develop a test for the MOG antibodies on living cells, which are the best assays for the detection of the antibody in the world.
Here at Mayo Clinic, we developed the first ever multidisciplinary clinic of MOGAD in the world. So we will have patients see our ophthalmology specialists, our urology specialists. They may see also a cognitive specialist to check on their memory. So we really have that holistic multidisciplinary care to assess all aspects of the MOG antibody disease. And I think we have the expertise. We're leading the way in many of the research studies in MOGAD.
When we're dealing with complex neurological disorders, coming and seeing a physician whose main focus, not only from a clinical perspective, but also from a research perspective, I think there's a huge gain for patients, because it makes the roadmap so much clearer if there's clarity around the diagnosis and the treatment plan.
There are many patients out there who come to Mayo Clinic, and Mayo Clinic is their last hope, and we really want to make sure that we get them the answer that they need for their condition. The future is very bright for our MOGAD patients. We're going to be able to get them on the correct treatment, and we'll be able to get them the right plan going forward.